Good afternoon, respected chairpersons and ladies and gentlemen. My free paper is on deep digital learning with virtual staining in fungal corneal ulcer. Myself and my co-author do not have any financial disclosure to make in this presentation. This is purely an academic one. Well, ocular mycosis affecting cornea can be seen grossly in slit lamp by using in vivo stain such as fluorescent strip or sometimes solution fluorescent. We have seen innovative in vitro fluorescent stain in raw specimen and published the data in 2020 at IGO, and we had studied a green laser in fungus. This is unpublished, and I presented it in Kolkata AIOS last year. Light is a form of energy, and design of microscope is to utilize the energy to our advantage. Refraction can cause problem to the observer, but this principle can be used to have a good effect in the microscope, for instance, in polarization, dark field, and phase contrast microscopy. Microscope with apochromatic objective in comparison to achromatic objective in the microscope is a better way to visualize the fungus. The objective of the study is to use the virtual staining in fungal corneal ulcer. This was institutional ethics committee approval was taken for the study. Experimental observation prospective study on corneal scraping and corneal button in therapeutic keratoplasty were in the cohort, and raw specimen, paraffin wax specimen were photographed using polarizer, dark field, and phase contrast procedure, and the microscope used was Axioscope 5 with a camera 208 Zeiss in German makeup. Now, these were compared with histopathological staining and spatial staining with Grocott's methyl and silver staining was done. 12 cases of mycotic corneal ulcer were studied. Different fungus included Aspergillus in 5 cases, Fusarium in 3 cases, Carbuliria in 3 cases, and Penicillium in 1 cases were studied with virtual staining. Here you can well appreciate the virtual imaging of a phase contrast and dark field along with the polarization having an effect in the virtual staining. Again, you see this is a Fusarium conidius, which are being seen in the polarizer by particularly the anisometric properties of the chitin layer help us to see in the polarizer. Dark field making the dark background, the fungus can be seen, and in phase contrast with oblique illumination, the conidias are visible, and they were compared with lactophenol cotton blue staining and other staining. Results were compared with conventional staining. You can well appreciate clinical a dry-looking ulcer stained with a solution fluorescent stain, in vivo and in vitro fluorescent stain that we have published, showing a beautiful conidia, and LCBS showing in microbiology department. And the green laser showing the which we have already made the study, and present study showed polarizer contrast, phase contrast, and dark field showing the. So in discussion, nonlinear microscopy has a capacity of linking the structural information in various fungus studied. Our study showed alternative way in conventional compound microscopy to detect the numerous ocular fungus. These are the different clinical picture, the KOH, which is done immediately, fluorescent stain that we have published, and Grocott's methyl silver stain, the green laser that we have presented last year, and the virtual staining in 2005 study, the present study. Spatial images could be acquired by point-to-point reference as in our study. Limitation of the study was sample size was small. Further studies in larger scale are required in future. So virtual image were effective in diagnosis of various fungus in raw specimen. Proper intensity of optical illumination can detect the fungus. In future, the use of properties of light, we can translate this innovation to real lifetime detection of fungus in corneal ulcer in slit lamp view. These are my selected reference. I like to quote that scientific imagination is the key for all innovations, and I like to thank our cornea department, SSDN microbiology department, Dr. Krishna, Mr. Kamal, and Apurva for the patient hearing. Thank you for patient hearing.
Nice presentation. You did not get any candida?
No, we later on, after the abstract was submitted, the candida, you see the yeast-like things which are globular, and sometimes it becomes some sort of confusive with the bacterial cocci. Okay, if there's a mixed infection, the yeast may be a difficult one comparative to the yeast-like filamentous fungus.
Yeah, Dr. Dipankar, nice presentation. One question, where would you see the application of this compared to the routine way of managing and, doing the microbiology?
Yeah, thing is that main idea is that whether we can pick up the fungus in the slit lamp without putting any, by doing a fluorescent stain, in vivo fluorescent stain, or by changing the properties of light with the converting a magnification of compound microscope into slit lamp. Okay, now whether by properties of light we can see in polarization OCT is there. Polarization OCT in anterior segment, this innovation is going on. By changing the objective of a compound microscope in the slit lamp, I think we can one day pick up the fungus even without doing a staining.
Thank you.